Hi, my name is Reese. I'm going to be the student nurse today. I'm here to do a newborn assessment on your child. Is that all right? Awesome. Okay, to get started, I'm going to check your child's ID badges or bands. Okay, those match up. So this basically a head-to-toe assessment. We get some vitals and just look at your child and make sure everything's going all right. So first, I'm going to get the temperature. We take the temperature in the armpit because you don't take oral or rectal temperatures in newborns. All right, good. The temperature for newborn is between 97.7 and 99.5. Now I'm going to listen to your child's heart sounds and get the pulse as well. Okay, good. Your child's pulse is within normal range, which the normal range is 110 to 160 for a newborn. Moving on, I'm going to, there's nothing wrong with the heart sounds or anything as well. So now I'm going to listen to your the lungs and count the respirations as well. Okay, good. The respiration is also normal as well. Normal for a newborn is between 30 and 60 respirations a minute. There were a little bit of crackling in the lungs, but that's normal. After a birth, there's still a little fluid in the lungs, so that's normal. So there's nothing to be worried about with that. Okay, so now, next thing we'll go to is the abdomen. I'm going to listen to the abdomen and listen for some the bowel sounds of the child. Okay, good. Active bowel sounds. So last time the baby was either poop or peed? An hour ago? Okay, that's good. And when was the last time you fed him? 30 minutes, okay, that's good as well. So moving on, I'm going to go from head to toe and assess the child. So first I'm going to look at the head. Look for molding, which is just the shaping of the head after birth. I don't see any points or anything, so that's good, or any dents. Also, I'm looking at anterior and posterior fontanelles. Those look good as well. There's no overlapping suture lines as well. I'm looking for cephalohematoma, which is blood point in the brain, or not in the brain, but in the skull. And then there is none of that. And then I'm also looking for Kappa D something, which is fluid filling in the skull as well. There's none of that. I don't see any bruising or cuts or anything on the head, so that's good. The baby has good range of motion in the neck as well. Okay, so now I'm going to look at the eyes. The eyes are symmetrical. They take up 2/3 of the face. I don't see any subconjunctival hemorrhaging. There's no drainage coming out of the eyes either, and there is no epithelial folds as well. Now onto the ears. The ears are symmetrical on both sides as well. The top of the ears line up with the corner of the eyes. And that is good. I'm going to check the recoil of the ears now to see which it shows the term of the baby right now. So, okay, good. All right, good. So that is good. They have good recoils. Now I'm going to check the patency of the nose. Just close one nostril and check the other while the baby breathes. Okay, good patency in that nose. Good patency in that nose as well. All right, now I'm going to put some gloves on. All right, I'm going to check inside the baby's mouth. I'm going to feel around, feel the soft palate, the hard palate in there. I'm going to see if the baby has any sucking reflex as well. All right, the baby has a good sucking reflex, and for the hard and soft palate, they're both intact. I don't feel any cuts or bumps or anything on them, so that is good as well. All right, so I'll take my gloves off real quick, wash my hands. Now, I'm going to check if there are any masses around the neck or anything. There is not, and then the clavicles are both intact. I don't feel any lumps or anything, so that is good. After birth, sometimes clavicles may break or something, but no, they are both intact and they're good. All right, so now onto the abdomen. I'm going to palpate the abdomen. Feels good. I don't see much distension. It's a little round, but it's not really distended. Now for the umbilical cord, there is no drainage, no redness or anything, but it is yellow, which is normal, so that looks good. And then as I was listing the lungs earlier, I was also listing for respiratory distress, and there's no apnea, there's no grunting, no refluxing, and nasal flares wasn't there either, so that is good. So now onto the female genitalia. The major labia covers both the minor labia and the clitoris as well. So with that, there's also a little bit of blood drainage, it looks like down here. It's nothing to be too worried about. It's not much, but that is a normal thing for baby girls, that since the mother you have like your hormones from the birth kind of get passed on to her as well, and it can cause like it looks like a fake period almost like that. So that is normal though, so it's nothing to be worried about. So with that as well, if it was a male, I would feel the testes, see if they've descended, and then I would look at the scrotum for the deep rugae, if there is any. Then I would also look at the urinary media to see if it's midline in the penis as well, and lined up where it's supposed to be. Okay, so now I'm going to check the reflexes in the arm. Okay, good. Good reflexes as well. So there are 5 fingers on the right hand with multiple creases on the inside, and there's 5 fingers on the left hand with multiple creases on the inside as well. That is good. Now onto the toes. I'm going to check. So they do have 5 toes on the left foot and 5 toes on the right. There's creases on both feet as well. So now I'm going to do the Babinski's reflex. All right, good. So the toes did flare on the left foot there. That's a positive sign or good sign. And then same on the right foot. Those toes did flare as well. So that is good. Now onto the skin. It's not dry. There's no peeling skin. I don't notice any cyanosis or anything. It is pink, but there's no jaundice, it looks like. I looked into the 5 spots and I didn't notice any jaundice. So that is good. So now I'm going to check the baby's spine. So let me flip her over real quick. Okay, the baby's spine is midline, it's intact. There's no dimples or hair either back here, so that is good. Also in the front, I didn't notice like any vernix as well from post-birth or anything, so that's good. Baby's clean, and everything. Skin has great integrity. Let me check the skin turgor though real quick. I'm just going to pinch the abdomen. Shows a little bit of hydration or for dehydration. Okay, that is good. That's good. It reflects fast. And lastly, the baby has been greater nurse, just relaxing, hasn't cried at all. And then I'm going to test its Morse reflex. So the baby did respond to that, so that's a good sign. That is responding to sound, loud sounds and stuff, so high pitched sounds. That is good. And yeah, so I believe I asked you when last time the baby voided or anything. You said an hour ago, and then you also fed her 30 minutes ago. So everything should be good. I should be back in the next hour. Thank you.